Escalar fish, risk of oily diarrhea in people over 50. Escalar, also known as oilfish or butterfish, is a deep-sea fish that is sometimes mistaken for tuna or other whitefish due to its similar appearance and rich flavor. However, behind its buttery texture lies a hidden health risk, especially for individuals over the age of 50. The main concern with escalar is its high content of wax esters, also known as gemplatoxin. Unlike regular dietary fats, these wax esters are not easily digested or absorbed by the human digestive system. When consumed in significant amounts, they accumulate in the intestines and can cause a condition known as chyruria, a sudden onset of oily, orange-colored diarrhea that may occur within hours of eating the fish. This condition is not only unpleasant, but can also lead to dehydration, abdominal cramps, and gastrointestinal discomfort, particularly dangerous for older adults whose digestive function is already less efficient. In people over 50, the risk becomes more pronounced. With age, the body's ability to process certain fats declines, and the gut becomes more sensitive to irritants. For those with underlying digestive issues, high cholesterol, or cardiovascular disease, consuming escalar may exacerbate symptoms or cause acute gastrointestinal distress. Moreover, escalar is often sold under misleading names such as white tuna or butterfish, making it harder for consumers to recognize and avoid. This mislabeling problem has led to accidental consumption in many countries, prompting several food authorities around the world, including those in Japan and Italy, to restrict or issue warnings about its sale and labeling. To protect their health, individuals over 50 are advised to avoid escalar altogether or consume it with extreme caution. If eaten, it should be in very small portions, less than 60 grams, and never combined with other high-fat meals. Watching for vague seafood labels and asking specifically about the type of fish being served can also help avoid unintentional intake. In summary, while escalar may appear appealing due to its rich flavor and silky texture, it poses a real health risk, especially for older adults. Understanding the potential effects and avoiding or limiting consumption is a smart and safe choice to support long-term digestive and overall well-being. Escalar, tasty but risky. Due to oily diarrhea. Escalar, also known as butterfish or black cod, is a white, rich, and flavorful fish that has gained popularity among seafood lovers. Often served grilled or as sashimi in many seafood restaurants, escalar is mistakenly perceived by some as a premium, health-conscious choice. However, beneath its creamy texture lies a hidden danger, especially for individuals over 50. The most notable aspect of escalar is its high content of gemplatoxin, a type of wax ester that resembles fat but cannot be digested by the human digestive system. When too much escalar is consumed, this waxy compound travels through the digestive tract and into the colon, causing a condition known as oily diarrhea. This results in loose orange-colored stools with visible oil, along with unpleasant symptoms like abdominal cramps, nausea, dizziness, or bloating. In younger individuals, these effects may be temporary and resolve within 1 to 2 days. However, in older adults who are more vulnerable to dehydration, electrolyte imbalances, and instability, this condition can become serious. A sudden episode of diarrhea can lead to low blood pressure, prolonged fatigue, or even increased fall risk, especially in those taking medications for heart or blood pressure conditions. Some countries, such as Japan and Italy, have banned escalar in the food industry. Others advise limiting consumption to less than 100 grams per serving. However, due to its unfamiliar name, consumers can easily confuse escalar with other fish marketed as butterfish or white tuna. For this reason, individuals over 50 are strongly advised to avoid eating escalar, especially when the origin or exact type of fish in sashimi or fillets is unclear. Safer, more digestible alternatives like salmon, mackerel, or sardines are better choices, offering heart, brain, and digestive benefits without the risks. Tuna, mercury contamination risk. Deep-sea tuna, particularly larger species, can accumulate significant levels of mercury, a toxic heavy metal that poses health risks. Once ingested, mercury can severely impact the nervous system, liver, and kidneys. Frequent consumption of tuna can lead to mercury buildup in the body, potentially causing symptoms like hand tremors, memory loss, anxiety, and other neurological issues. For individuals over 50, the risks are even greater. As the body's ability to eliminate heavy metals decreases with age, the chances of mercury accumulation increase, raising the risk of long-term health complications. Mercury toxicity may impair cognitive function, memory, and even increase the likelihood of neurodegenerative diseases such as Alzheimer's. To reduce this risk, opt for smaller tuna species, which tend to contain lower mercury levels than large mature oceanic tuna. Older adults should limit their intake of deep-sea tuna to no more than 1 to 2 times per month and incorporate safer alternatives like salmon, mackerel, or sardines into their diets. If choosing to eat tuna, it's best to avoid raw forms such as sushi or sashimi. Instead, opt for cooked dishes like steamed or grilled tuna. Pairing these meals with detox-supporting foods like leafy greens, garlic, and natural spices can help protect the nervous system and liver from mercury exposure. Antonisho, Narshungekini swordfish, high methylmercury content. Swordfish, a popular choice in international cuisine, is among the fish species known for high levels of methylmercury, a hazardous form of mercury, especially dangerous to older adults. Methylmercury can accumulate in the body and negatively affect memory, reflexes, and mood, while also raising the risk of cognitive decline. For individuals over 50, who may already be at increased risk for memory issues and brain-related conditions such as Alzheimer's, frequent consumption of swordfish can further endanger neurological health. Methylmercury damages the nervous system, particularly cognitive functions, making it vital to limit swordfish intake. Older adults are advised to eat swordfish no more than once a month, or better yet, avoid it altogether. Choosing fish with lower methylmercury levels, such as salmon, mackerel, or sardines, not only lowers the risk of toxicity, but also offers benefits like omega-3 fatty acids, high-quality protein, and essential nutrients. Additionally, safe preparation methods matter. Gentle cooking techniques such as steaming or grilling are preferred, as they help reduce the risk of releasing toxins during cooking. By making safer fish choices and preparing them properly, adults over 50 can maintain a healthy diet without worrying about methylmercury's harmful effects. Farmed salmon, potential chemical contamination. Salmon is one of the most popular types of fish and is rich in omega-3 fatty acids, which are beneficial for heart and brain health. However, when it comes to industrially farmed salmon, seniors should be aware of the risk of chemical contamination. Due to poorly regulated farming environments, farmed salmon may contain PCBs, polychlorinated biphenyls, toxic chemical compounds, as well as heavy metals like mercury. These substances can negatively impact the liver, endocrine system, and immune function, especially in older adults whose immune systems are often weaker. PCBs and heavy metals accumulate in the body and can increase the risk of liver disease, cardiovascular problems, and even hormonal imbalances. For individuals over 50 with declining immune function and detoxification capabilities, regular consumption of farmed salmon may raise the likelihood of encountering serious health issues. Recommendations for seniors: opt for wild-caught salmon raised in cleaner and safer environments. Avoid industrially farmed salmon. If consuming salmon, limit intake to about twice a week. Choosing natural salmon reduces the risk of chemical and heavy metal exposure while still providing essential omega-3s to support heart and brain health. Additionally, when preparing salmon, choose gentle cooking methods like baking or steaming to preserve nutrients and minimize the risk of harmful chemical formation during cooking. The farmed basa, risk of antibiotic residue. Basa fish is a popular choice due to its affordable price and tender, easy-to-eat meat. However, for industrially farmed basa, seniors should be cautious of residual antibiotics and chemical contaminants. Basa is often raised in poor water conditions and may be treated with antibiotics and chemicals to prevent disease. Improper use of these substances can lead to their accumulation in the fish, remaining even after the fish is cooked and consumed. Antibiotic residues not only affect consumers' health, but can also contribute to antibiotic resistance, a serious issue, especially for seniors. Resistance reduces the effectiveness of antibiotics when needed, making disease treatment more difficult and prolonged. Older adults with compromised immune systems are particularly vulnerable to these risks. Recommendations for seniors: choose BASA with safety certifications, clear sourcing, and strict farming regulations to minimize antibiotic and chemical residues. When cooking BASA, opt for methods like steaming or boiling rather than frying or grilling to avoid producing harmful compounds during cooking. Gentle cooking also helps preserve the fish's nutrients while reducing hidden health risks. Kosher fish is a nutrient-rich food source, offering many health benefits, especially as a source of easily digestible protein, omega-3 fatty acids, and essential minerals like selenium and iodine. However, for individuals age 50 and older, choosing fish requires more care, as not all types are suitable for their health needs and conditions. Here are some key principles to remember when choosing fish for people over 50. 1. Prioritize small, surface-dwelling fish. Species such as sardines, small mackerel, and herring are good options, as they are generally lower in mercury, a heavy metal that can harm the nervous system and overall health. 2. Avoid farmed fish with unclear origins. Fish raised in poorly controlled environments, especially those likely to contain antibiotics and pollutants, can negatively impact elderly health. Always choose fish with clear sourcing and safety certification. 3. Use healthy cooking methods. To protect cardiovascular health and reduce unhealthy fat intake, seniors should avoid deep frying. Instead, prioritize steaming, boiling, or light grilling to preserve nutrients without increasing heart disease risk. 4. Monitor body reactions. Seniors, especially those with a history of gout, cardiovascular issues, or digestive disorders, should monitor their body's response after eating fish. Any unusual symptoms such as joint pain, indigestion, or fatigue should prompt a consultation with a healthcare provider to adjust dietary choices accordingly. Making the right choices in selecting and preparing fish will help seniors fully benefit from its nutritional value while avoiding potential health hazards. Although the fish mentioned above are not strictly forbidden, seniors should carefully consider their inclusion in weekly meal plans. Eating fish is not just a dietary choice, it's a strategic approach to healthy living. Choosing the right fish and preparing it properly supports heart and brain health, along with other bodily functions. This plays a key role in maintaining a healthy, alert, and joyful later life, helping older adults live with vitality and happiness during their golden years.